Next talk with Dr. Prasanna Venkatesh Ramesh.
Dr. Matthew, you could be sitting.
And
Next.
Dr. Virendra Agarwal will the discussion for this topic.
Dr. Virendra Agarwal.
Can I start, sir?
Yeah, please carry.
Mine is an innovative surgical simulator which was self-built by us, and we have also got the patent for the same. So MIGS is something that is taking the field by storm, especially for glaucomatologists. So this is one of my patients where I stent inject. I place the inject very well, but when I'm using the sodium hyaluronate or the Elon, can see how it just went away and it's just floating there. So I'm then placing the second stent, and I'll have to retrieve the second stent again. And since I had two more extra clips, and again you saw when I took it out in the initial phases, it's quite complex when you lose a stent. So it just got caught in the incision, and then I was able to place the stent very well. So this microsurgeries, they need a lot of precision and they need a lot of hand-eye coordination development. So we wanted to make a lot of simulation. So I have my own metaverse lab, and I've been doing extensive work in that. So we felt we had to make a simulator for an MIGS because it is something that is taking the field by storm. So this is the AR headset that we have, and you can see how we are doing the coding. So this is like real time on the right hand side. So especially micro surgeries like minimal invasive glaucoma surgery, which is very highly talked about because of the results it's producing, especially the eye stent and the eye stent inject, and even the eye stent infinite that is going to be launched very soon in India. So you can see here, this is hand-eye coordination training that is being done by the neophyte before the surgery is being placed. So when he places the stent correctly, there has been a simple cue that is given that you can see a green color hit comes up. If it's wrong, it just doesn't light up. So these are some hand-eye coordination tools which is very important, I feel, so that you can have a good final placement of the stent. As you can see here, before you make a mistake, you can actually do these things because not many people work on. We have simulators for cataract, we have for phacoemulsification, but MIGS is something that is very upcoming in the field of ophthalmology. So this is again one of the patent protected technologies of ours, where we did analyze the wet lab training of this novel simulator versus the wet lab training. The survey is it's very early to say, but the results are very fair. I won't say it's so superb or anything, but neophytes feel that definitely the hand-eye coordination is better for the MIGS surgery going forward. They are satisfied to a very good extent, as you can see. It's a very small sample size. I just did this among the first year and second year residents of my institute. They are around 9 in number. And the simulator training, you can see that it doesn't say that the confidence improves during surgery. They still feel surgery is surgery, but this just gives you a good orientation. Mistakes, yes, the most of them told no, unless it's a real time. The rating, how would you say it is? It's 3, 4 to 5. That means they feel it's much better if they get a good hands-on view before the surgery is done, because the risk of harming the patients to an extent is minimal. And would you recommend this kind of simulator? Especially, you can see that today, if anybody wants to use it, it's cost effective, it's portable. You can have it on your head, and I can just show how we did the G1 simulator. If somebody does it 10, 15 times, they can go forward and then they can place their G1 tomorrow if they are oriented well with their direct gonioscopy technique that they have in the OR. So this is something that we say as the world of metaverse, and we are working extensively on it. And this is a self created MIGS simulator that I wanted to present today. And we also use own images. So there are many augmented reality modules that come. We are using their own fundus images, and we are using the patient's own gonioscopic pictures for the angle as well. So that is where we specialize in. And this is my innovation that I wanted to present to the Elite panel on MIGS, which is very much upcoming. And this is a cost-effective, patent-protected 3D MIGS simulator for ambidextrity training and for neophytes. Thank you.
Nice, Pranish.
Dr.
Yes,
Virendra
Dr.
Agarwal.
Virendra Agarwal.
Yeah, mesmerizing. Very good.
Yes.
But I think you are doing only for the glaucoma valves.
Sir, the glaucoma is something that the other competitors, especially we have our own startup, sir, now. I'm an eye doctor, but I do have my own department. So glaucoma is something that I specialized in. And
Okay.
SACS and cataract in phaco, many people are taking up that job. This one in MAGS, when it took India by storm, especially the suture GAT also, the microscopic level of that surgery demanded a good simulator, sir. It's somewhat fill in the blind spot of the people who are making simulators, because there is a lab which makes a simulator for cataract, but I felt because of the simulator thing, not many people are taking up MIGS. That's why MIGS is still not went that forefrontier as compared to the other one. So I am currently making MIGS, but I'm working on SACS and FACO, which is still not ready, sir. At least in my hands, I have not made it ready.
No, as far as I could understand, you don't require an eye in this. You are just using your hand-eye coordination. So
Yes,
if
sir.
you make it for cataract,
Yes, sir.
it will be very cost effective because in cataract you require many other things.
Yes,
If it
sir.
can be, feeling can be done through that. So that was my
Yes, sir.
concern.
Yes, doctors, come forward and sit down.
Yes, sir. For even this kind of simulators, or even the smartphone, we are currently launching it. Metaverse is something I'm exploring in a very different level, sir.
Yeah.
And this simulator is, as you told, it's very cost effective, sir.
Yeah.
Even with the headsets that you have, Jio's launching their own headset for 30,000 or 40,000, and its portability is something which is very useful. You don't need to be anywhere. You can just, I mean, after the end of the session, I can show you a demo if time permits.
Yeah, I agree. What I'm just worried about that when you do simulation, if your hand moves in between while you're injecting something, because you're not having any pressure feeling when you inject the stent or something, so that feeling may change your actually the placement. As you show the first case, you are in the right place, but after injecting, it was not in the right. So I think that simulation cannot be felt with this until there is something physical.
Sir, there is a technique called, if you see the headset where we wear it in the ear, there is a technique called haptic sensation or a haptic stimulation. When we type messages in our phone, you get that click sound. You get that.
Yeah.
Similarly, when you place it in the right plane, there is a click sound that you will hear. That means it's in the right plane. So there is as much mimic as possible in the here, especially that haptic.
No, I
click.
agree, but when you put the stent, you have to
Yeah.
first localize it and then press it.
Correct.
So that pressure
Photo,
will
photo.
change your hand position. But still,
True, sir. True, sir. Yeah,
still
nothing
a
like
very
a
good
real,
approach.
real skilled surgery. But
But
this is to an extent it will help us in.
yeah, I think, but you should
Addressing
have
the
one
issue.
team working on cataract. That will be much more useful.
Yes, sir. Yes, sir. We are trying to focus on MIGS for
But a
now.
very
But
good
yes.
innovation.
Thank you,
Very
sir.
good.
Thank
Very-
you.